Hi, and welcome back to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the fourth and final video in the exercise program, neck exercise program number 1. If you remember back to that first video that we watched together, I showed you how to check range of motion in your neck. And if you found that you were lacking some motion turning your head or bending your head, I told you I had some techniques that I'd show you to help improve that motion. And that's what these are. They're called self-mobilization techniques. So what does that mean? It means that you're trying to increase or improve motion or mobility at a specific joint. And you're doing it yourself, so self-mobilization. So for these techniques, I'm going to show you 2 different motions with the same hand placement and everything. So it's kind of like one technique. When you do this, make sure you're sitting up nice and tall like I've asked you to do in the other videos when you do those exercise programs. You're going to use the pinky side or pinky border of your hand. You're going to place that alongside and make sure you're back far enough to where you feel that tenderness, where you feel your typical pain in your neck. Just make sure you're staying off of those delicate structures in the throat. So if you're back where you feel your typical neck pain, then you know you're in the right spot. And you want to just use that pinky border of your hand to find one of those tender spots. Then you're going to just place your hand here, apply some pressure. So make sure that hand is there nice and snug along your neck, and even apply a little bit pressure inward. And then what you're going to do is just bend your head over your hand, keeping your hand nice and still, and even with a little bit of pressure inward towards your neck. Looks just like that. Right? So that's one motion. The other one you're going to do is turning your head like that. All right. Now, when you do those, at each level that you find, I want you to do 2 to 3 repetitions at each spot, and you're going to hold each repetition for 10 to 15 seconds each time you do that. You may find that it's uncomfortable. It does give you some pain, or sometimes my patients even say, oh, it's a good hurt. Any of those, then it's okay to do. I want you to keep doing those techniques. You will find after about a week or 2 that it's actually much more comfortable, and you don't have the pain that you had when you started. So typically I want patients to do, or people to do, these exercises for up to 2 weeks. You may find you only need it for a week. You may find you need it a little bit longer than that. It just depends on how long you've been dealing with this neck pain and kind of how big of a vicious cycle you've been in. So if you find that your pain is decreasing, your motion is getting better, you can turn better, and you can bend that head better, then you know these are working for you, and I want you to keep going. So again, these are called self-mobilization techniques. And you're going to do this for bending the head over your hand and turning the head towards your hand. At each spot, so maybe 2 or 3 spots that you find in there that are really tender and sore, I want you to do 2 to 3 repetitions, holding each repetition 10 to 15 seconds at each spot, and make sure you're doing both directions if you feel like you need that. So now you have all the exercises that you need for this neck exercise program number 1. So I want you to write these exercises down if you need to. Take that to work with you or wherever you go. Write them down so that you'll know what you need to do, and it'll just be a good reminder to get them done frequently throughout the day. Remember, in this stage, I need you to do these exercises frequently for the first week to 2 weeks. So you're going to commit to this for up to 2 weeks, see how you're doing, and if we're getting rid of that nagging, aching pain that's keeping you from doing what you need to do, and your motion is improving, you can start to turn and look up and do the things that you need to do, then just keep going. Go on to exercise program number 2. That's really important because we got to keep advancing this whole process to get you through the whole recovery phase. So get going and get rid of that pain, and I hope you'll find you can get back to the things that you need to do.